Assalamu alaikum and welcome to Let's Talk. I am your hostess, Dr. Anita Raja. And we hope that you're going to be part of our show today. You can call us on 01924231083 and you can WhatsApp us on 07585835150. Like every week, even today, we've got a very interesting topic. Now, you must imagine that breastfeeding must be so natural to every woman. I mean, when you think of pregnancy, childbirth, and then breastfeeding, most of us imagine that it must be easy peasy and just part of the process. But unfortunately, it is not as easy as it sounds. I thought it might be very interesting to sort of have a chat about this on our show today and talk about the struggles, the challenges that many of us face, but maybe don't really want to talk about. So today we've invited on our show Shaheda Yasmeen-Khan. She is a breastfeeding specialist, a midwife. Welcome to our show.
Hello, Anita. Thank you so much for having me.
Shaheda, first of all, I just want to ask you that golden question. What made you choose this side of our clinical profession?
So, midwifery or breastfeeding specialism, or both?
Both.
So both. I think my mum was a very key factor to me becoming a midwife. I just used to grow up listening to her as an ethnic minority, unfortunately, not having the best of care after having her babies. So that kind of drove me to become a midwife. I actually had no interest in breastfeeding. I didn't know what kind of avenue I wanted to go down in terms of midwifery. But I realized within my family that a lot of my relatives weren't breastfeeding. They didn't really know much about it. They weren't getting the support, even from the elders. There was a lot of cultural barriers that were affecting their breastfeeding experience. So that kind of made me want to become a specialist in breastfeeding to help out everyone in their breastfeeding journeys, but also women in my community, because I realized that they were having setbacks that they weren't aware of, and I thought I could educate and empower them as someone that they could be familiar with, be comfortable with, to talk about something like breastfeeding. So yeah, I've been a midwife for 8 years now, and I've been doing breastfeeding specialism for about 5 years.
And you seem to be enjoying it quite a lot. I mean, you've been talking about the challenges within, our community. There are cultural challenges that we face, and we don't really know what these challenges are. Do you want to shed some light on this aspect?
Yeah, the main challenge I have with supporting moms in their feeding journeys is their breastfeeding being undermined by elders, unfortunately. You would think that, I'm from Bangladesh, my husband's from Pakistan, my mother-in-law's from India. Like, you would think that being from those countries, less economically developed countries, not exposed to formula at all, they kind of have no choice but to breastfeed. So breastfeeding is the norm back in those countries. So you would think that bringing those traditions and cultures into the Western world, that our generation above us would be encouraging and empowering our generation to breastfeed. But unfortunately, that's not the case. I think it's because our generation came to the UK at a time where formula was being marketed hugely. So they just probably thought this country knows best, the doctors know best. And just breastfeeding became undermined, and formula kind of took over as this medicine that is best for your baby. Whereas obviously now in our generation, we teach antenatally, there's posters everywhere in the hospital, how beneficial breastfeeding is, how beneficial breast milk is. So our generation understands that, but the older generation, unfortunately, because they didn't have this exposure to this education, they don't understand that. So when it comes to breastfeeding and then respecting our elders and then them intervening with our feeding journeys, it's very hard for our generation to educate the older generation into why breastfeeding is beneficial. And then also our women my age not understanding the impact of that intervention. So the key intervention that a lot of mums and mother-in-laws kind of say is like, the baby's feeding a lot, give a top up. You don't have enough milk, give a top up or formula. And girls do it because they think, you know, my mum, my mother-in-law, they know best. But what they don't understand is biologically they're actually impacting their milk supply, which then shortens their breastfeeding journey, and then they end up formula feeding, and then it upsets them. So it's just like a domino effect on the introduction of formula, and it's just both generations not understanding that part of feeding.
It's just so beautifully that you've explained the whole thing, and you're absolutely right, because I guess a part of our culture also is that we respect our elders, and then there's a lot of interference, let's say, and everybody has to have a say. It's not just the mother and the mother-in-law, it's the aunties, the cousins, anyone who's going to pop by to see the baby is going to bring a piece of advice with them. And it's going to make you feel quite bad about the way you are doing things, which you probably aren't doing right. And especially if you are a first-time mom, that has a huge impact on the way you feel about yourself and your skills and your ability, and it knocks your confidence. Now, Shaheda, another thing that we usually see is that within our culture, there's a lot of, this custom where lots of people are living together. There's a joint family system. Have you, in your practice, seen that that can also affect a woman's ability to breastfeed?
Yeah. Unfortunately, yes. It comes from both sides. It comes from the mother who wants to breastfeed because she's scared of being cooped up in the room, and the in-laws are going to think bad of her. They're going to think she's lazy. And then the in-laws, from their perspective, it's like, oh, I want to see my grandson, my granddaughter. She's, you know, just upstairs all the time. Like, why doesn't she just give a bottle? Then we can do it. We can help. But again, it's just that lack of understanding from. So when we in the NHS talk about breastfeeding, we're talking about it from, yes, the health benefits of the breast milk, but the bonding benefits that breastfeeding has and how that's optimal for the baby's brain development. And unfortunately, the older generation don't understand that. So that's why for them, it's so easy to be like, just give a bottle, it's fine. And for the mum, it's her reputation as a daughter-in-law that prevents her from wanting to exclusively breastfeed. One of the main things that I do in my profession is try and empower the partner, because if you're living with in-laws, unfortunately, the only person that can sort the parents out is the partner. So if the partner understands the importance of breastfeeding to his wife and to him as well and to his child, he can educate and make his parents understand, like, no, this is what we want to do. So that's how I kind of use my role to try and change that culture of, you know, daughter-in-laws breastfeeding in their household.
You've hit the nail on the head there, haven't you? Because you're actually bringing on board the person who can actually have a huge impact on the breastfeeding journey, the mother's breastfeeding journey. Now, in terms of knowledge that people have around breastfeeding, yes, you're absolutely right. There's a huge push from the NHS. That's something that we encourage. If you look at the NICE guidance, there's a lot of talk about breastfeeding being very important. But in terms of support, is there much support out there, especially for people from the BAME community?
So that's, I hate to say it, but unfortunately not. Like maternity is struggling as a whole already, like especially post-COVID, but even pre-COVID, postnatal service is known as the Cinderella service. Unfortunately, we have 27 patients on a ward. One midwife will have 9 mums plus 9 babies. If a mum has twins, that's, you know, an extra baby. And that one midwife has to provide all that care for that woman. I do private breastfeeding support, and I spend 2 hours with one woman giving her breastfeeding support. And it's not just breastfeeding support, it's emotional support, it's a listening ear, it's her shoulder to cry on. It's a lot to take on. So when we've got 9 women who want to breastfeed and on a 12-hour shift, it's really, really difficult to give that support to facilitate breastfeeding. On top of that, we don't have the support staff. So in other countries, you know, they have specific lactation consultants that will go out and do home visits to support breastfeeding. And we don't have that here. We just have a community midwife who does a minimum of 3 visits. And if the baby's back up to birth weight, whether she's breastfeeding or mixed feeding, she'll be discharged after 10 days. And she's kind of left to look after and feed her baby herself. So yeah, unfortunately, postnatally, we just don't have that high quality, service to provide women to support them in their feeding journeys.
And was this ever any better? I mean, now, of course, we know we've been hit by the pandemic, the resources are scarce and things look quite dire. I mean, I've had a COVID baby myself, and I can vouch for it was dire. It was absolutely dire. And the difference between me having a baby 8 years prior to the baby I had last year, I mean, I couldn't believe what had happened to the services. But do you think that it was any different, much more supportive back in the day, or was this something that has always been lacking the funds?
I do think it's always been lacking. Like we're spending so much time on telling mums why breastfeeding is great and why they should do it, but we're not actually spending enough resources on supporting mums in doing it. Like, for example, 3 home visits after the baby's born and then to discharge them, like, that's just not enough. And antenatally, they get seen every 2 weeks towards the end of their pregnancy.
No, definitely. And also a lot of these patients then turn towards their GPs, the general practitioner, and want advice with regards to their breastfeeding from the general practitioners. And I am one. And unfortunately, I feel that it's just not part of our curriculum. I mean, there's not much information out there. We don't know much about it. Nobody trains us or tells us where to look. And it's all self-education. So we're looking around, searching for things, Googling for more information, because unfortunately, there isn't much information out there. And it is something that is so vital. How can we push for something when we are not actually offering the support that is required for it? I mean, it is so interesting to have this chat with Shaheda, because she's also explaining the difficulties that women from the BAME community have in terms of breastfeeding, because there is a lot of interference from the in-laws, from family members, yet the support isn't there. If you want to be part of our show, our number is on your screen. You can see our WhatsApp number. You can WhatsApp us. It's time for a break. Stay with us. Welcome back to Let's Talk. Before we went on to the break, we were having a lovely chat with Shaheda, and we were talking about the struggles, the challenges that women from the South Asian community in particular are facing when it comes to breastfeeding. If you want to be part of this show, you can call us on 01924231083, and you can also WhatsApp us on 07585835150. The number is on your screens. So Shaheda, before we went on to the break, we were having this lovely discussion around the challenges that women do actually face from within our community, because there's a lot of interference, and there's so many people who are giving you advice who don't know much about it in terms of scientific evidence, like you explained quite nicely and aptly. Now, you are South Asian yourself. Does that put you in a position of privilege?
Yes, and it's one of the reasons why I love doing what I do, because I feel like the South Asian community, we're quite, we keep ourselves to ourselves. And because we do get that guidance from elders or doctors in our family, we don't reach out to external sources. So being South Asian and a breastfeeding specialist, I also have my Instagram page, which has attracted a lot of attention from Muslim women, South Asian women, and empowered them in their feeding journeys, because they're learning stuff that they just had no idea, like about hormones and the role of hormones in breastfeeding and the impact of that top up their mother-in-laws telling them to give. So yeah, definitely, I feel like I am helping my community in my role.
And we're very grateful for it, because I must be honest, I mean, up until a couple of years ago, I had absolutely no clue that you could actually get the help you require from a breastfeeding specialist, because it's something that nobody tells you about. And especially for people who've moved to this country new, for instance, people who immigrated from South Asia, new mums, first-time mums, they have absolutely no clue about the help that you can provide.
Yeah, having a baby, especially postnatally, there's this surge of hormones that can actually impact women mentally. We talk about baby blues, we talk about postnatal depression, and a lot of this stuff our community is not aware of, especially baby blues, and in relation to breastfeeding. So, for example, on day 3, when your breast milk comes in, it is a flood of hormones that will just come and fill your breasts with breast milk. And it's that day where a lot of women are very weepy, they're very upset, they can get triggered and cry over the smallest thing. And sometimes women in our community, they think, oh my God, is this it? Is this postnatal depression? Because I'm just crying all the time. I don't want to do this and blah, blah, blah. But actually, it's normal. And that's why I like to use my role to explain to women, like, this is just nature. This is biology. This is the role of your hormones. And then it relaxes them. It educates them. They're aware of what their body is doing. And they're confident to just go with it.
Mm-hmm. Because I guess, within the culture, as I've said, the baby is born, lots of visitors are going to visit you, and everybody's going to give you a piece of advice and tell you what you're doing wrong. And there is a lack of encouragement in general. I mean, they don't mean to hurt you, of course, but this is something that is seen. They're trying to help you in their own little way and trying to make your life easier by saying, yes, just give them the top-up bottle at night. Give us the baby, we'll look after the baby, we'll help you out, all that advice and support, which is not really support in the long run. Yeah. Now, once a woman's confidence is shattered like that, what have you seen in practice? How easy is it to support her back and then bring her back on track?
So through education. So a lot of the time, a lot of my clients, they come to me because they're worried their milk supply is dropped. They're worried their baby's not getting enough from their breast, so they have to give the formula. And then when I take a history as about, how did their feeding journey start, kind of what went wrong or what happened, majority of the time it's the top up, the introduction of that formula that has had a knock-on effect on their milk supply and their baby latching. So my main role in that is just educate them, just to tell them, like, okay, so this is what's happened, this is the reason why it's happened, and now to come back from it, this is what you need to do. And once they understand that, sometimes they can go back and tell their mums and mother-in-law, actually, I'm not going to give formula because it's going to impact my milk supply. And then the older generation, they're like, oh, okay, if the doctors or the midwife said that, then I'll accept it, kind of thing. Like you said, when they say, give that formula because you can get some rest, let me feed so I can help, it's coming from a very innocent place. They have no idea that this is actually going to affect your breastfeeding journey. So in my role, I just use that opportunity to educate and empower them in their breastfeeding journey.
And what sort of advice do you have for women who are struggling? For instance, some women can have very sore nipples, very painful nipples, that puts them off. Pumping can be quite painful. There's an element of pain as well that goes hand in hand with breastfeeding, especially if you're a first-time mom and you're not experienced and you've got no clue what to do. Yes. So what sort of advice do you have for those moms?
I'm so glad you touched on that, because sore breastfeeding, unfortunately, it's common, but it's not normal. But because it's common, a lot of women think this is how it's meant to be, especially in our community where, we don't reach out. So they just kind of soldier on, they power through with the breastfeeding, but they don't realize that the sore nipples is reducing their supply, which is why the baby's feeding a lot, which is why they need to give formula. So because they don't have that background and they just think it's normal, they just kind of continue. And again, that's where my role of just education comes into it, and then supporting them and fixing that. So positioning the baby, telling them the importance of a good latch, telling them not to do what they're doing and how that's impacting their feeding journey.
But when we look at women around us, as you've said, by day 3, there's a sort of hormonal surge. They're quite low. They're tearful. They've probably not fed their baby enough. The baby's hungry as well. The supply isn't great. And I think that day 3 actually decides it's a turning point in a woman's life, her breastfeeding journey, because that makes or breaks her. She's exhausted. She's tired. She's sleepless. This baby's waking up every hour. At that point, what advice do you have for moms who believe that by day 3 their baby is still hungry and they don't have an enough supply for their baby?
Utilize the medical support around you. You have your community midwife that's going to come and visit you at home. Please do not be afraid to tell her what's happening, what your end goal is in your feeding journey. Although community midwives only do reduced visits, they can do extended visits depending on your need. And again, unfortunately, in our community, we don't ask for more, because we think like we're going to put people out. But that's the role of the community midwife, to support you in your feeding journey. So definitely utilize your community midwife. Instagram, social media, like especially my generation of women, we're all on it. There's so many great pages out there that are giving breastfeeding support and advice. So get on those, and 3 o'clock at night when you're not able to feed, when not able to sleep, you can scroll through and get some support through there. And then your health visitor as well. After your midwife discharges you, your health visitor takes over. They're also qualified to give breastfeeding support. And then also you can look into like breastfeeding specialist midwives, counselors, lactation consultants. Like there's just so much support out there that our community is just unaware of.
And is it very expensive to get the support that you can provide privately, or is it affordable?
I think it's affordable for what you're going to get. I think the most important thing with your breastfeeding journey is to have one point of contact that you're happy with, you're comfortable with, who understands you, whose approach is relatable to you. Because it's when there's too many people interfering, even in midwives, like you'll get one midwife saying one thing and then another midwife saying another. So what you're paying for is that one specialist time and advice that suits you and your needs, and the continuity. And I think that's just so important when it comes to breastfeeding, just to have that continuity of care.
And in terms of milk supply, so you've said that, and you've pointed out that we shouldn't be using top-ups, and we should persevere. But is there any other advice that you've got? I mean, I've heard lots and lots of midwife tales telling us to turn a tap on, which helps, and drink lots of water, which can help. Does it really help?
So for me, so I don't want to come across like I'm a formula bashing midwife, because I'm not. Some mums choose to mix feed, and some mums choose to top up, and that's absolutely fine. My main aim is to target those mums who want to exclusively breastfeed but have these challenges of introducing formula where they probably wouldn't want to, and don't realise the impact that it's going to have on their feeding journeys. Yeah, I just wanted to put that disclaimer out there.
In the end,
sorry, just back to your question about the tap and the drinking of the water. The main thing is stimulation. When it comes to breastfeeding, the more you feed, the more you stimulate. The more you feed, the more you produce, and that's why formula actually has a negative impact on your milk supply, because you're reducing the amount of time your baby's on the breast, because you're giving that top up. So that's why your supply will gradually slow. So if you want to increase your milk supply, you just breastfeed, because it's that stimulation that's going to increase your supply.
Shaheda, I think you've put it quite beautifully, because you're absolutely right that you have to persevere. I guess it's a journey where you have to be very persistent, where you have to push, and you can't really become complacent and give up. But it's a painful journey sometimes for some women, because they don't have the support out there. But it's so reassuring to know that we've got people like you out there who can help. We have only 90 seconds left before we go on to our break. In the end, very quickly, do you have any message for women out there?
Listen to your maternal instinct. If you want to breastfeed, don't let anyone else interfere with your decision. Use your resources, empower yourself, educate yourself, and make sure your partner's on board as well, because that will really, really help you get your breastfeeding off to a good start.
Thank you, Shaheda. Thank you so much for being part of our show. It was an absolute delight to talk to you. You enlightened us with all the information that was needed. And folks, if you look at the whole scenario, so there's a scenario where we are South Asian, and it is just assumed that most of us will easily be able to breastfeed our babies because we'll have the support that we require from our family members who probably are from villages and can give us the right support. But it is not like that, unfortunately. So it was quite insightful to be able to speak to Shaheda and speak about the cultural barriers that we face because of the information that is given to us, which is not always medically correct. If you want to be part of our show, it is very, very easy. You've got our telephone number on your screen, our WhatsApp number. You can WhatsApp us, you can call us, but it's time for a break. Stay with us. Welcome back to Let's Talk. I am Dr. Anita Raja. Before we went on to the break, we were speaking to Shaheda, who was a breastfeeding consultant and was giving us lots of advice on breastfeeding. We talked about the cultural barriers that most of us face, but don't really talk about because it's culturally inappropriate to talk about it. However, now in our second segment, we thought it might be quite interesting if we would invite someone who could share her personal journey with us in terms of the struggles, the challenges of breastfeeding. So we have on our show, lovely Tess. Welcome to our show, Tessa. I'm so pleased that you're here with us today. I understand that you're on holiday, but you have made it to our show. So welcome, welcome, welcome.
Thank you. Thank you so much for having me. Yeah, I'm in deepest, darkest Norfolk, so I'm in the middle of nowhere.
I hope you enjoy your holiday. So congratulations on your baby. Your story is absolutely inspirational. And I understand that most women imagine childbirth, having a baby in a certain way. What was your dream? How did you imagine it to be?
Well, I've obviously, being a midwife myself, I've seen a lot. I've seen the good, the bad, and the ugly. I could say. In terms of what I was expecting to happen, I found that I was hoping that everything would be straightforward, and luckily, thankfully for me, things were straightforward in terms of my birth. I think my biggest wish was to be with people that I trusted in terms of the clinicians that were looking after me. I was very lucky that I had 2 friends that were on call to deliver my baby, so I was very lucky in that way. And I think whatever was going to happen with my birth, I knew that if I had those people around me and if I was in the environment that I was familiar with, so my place of work, that everything will be okay. And it was. So I was very, very lucky.
Yeah, and did you always know that you wanted to breastfeed, or did you ever think that, formula feeding would also be an option for you?
So when I was thinking about feeding my baby, I have obviously supported lots of women breastfeeding, and I've seen that, for some it comes very easily, but for many it can be quite difficult. And I have seen many women suffer with their mental health as a result of assisting a lot with the breastfeeding. So one thing I knew for myself was that I would give it a go, and if it wasn't working out, that I would adopt a really low threshold to move on to formula feeding. And that in my mind was, a sensible plan. I didn't feel particularly emotional about it. But when the time came, something changed within me, and I was really surprised. I started to breastfeed my son, and as expected, I came across some very normal issues. And rather than going back to my plan of having a low threshold to move on to formula feeding, I suddenly became really had a really strong innate desire to breastfeed my baby, and I would sacrifice anything to try and breastfeed my baby. So I basically went against my own plan, and But luckily for me, I received a lot of support, which we can go on to talk about in a minute. But it was a lot harder than I envisaged. I think being a midwife, I felt that I knew the physiology, I knew enough about breastfeeding to be okay with it. Actually, once my baby was here, my midwife had disappeared, and I just was a mother, and I was having the normal issues and problems that many women face when they try to breastfeed their baby.
Yeah.
But my desire to try and do it really took over.
And we're
Which took
proud
me
of you.
by
We're proud of you. We're proud of you for that, because it's not an easy one. Many women abandon the idea of pushing to breastfeed because of how difficult it can be, especially if your baby is not latching on. And I think what happened in your scenario was that there was an issue with the tongue tie. Tessa, do you want to tell us a bit more about how that affected your ability to breastfeed your baby?
So at the beginning, it was a normal problem of having difficulty with the baby latching, and that took a good few days. And what I found within that time, what was a useful thing to do was to actually, I'm sure Shaheda probably spoke to you about this, but to express colostrum, myself, and to feed the baby with a syringe. So if the latch wasn't good, or if the latch was still developing, I would use the expressed colostrum that I had harvested, and that really helped. Helped more than I realised. And it took, a good probably 5 or 6 days, maybe longer actually, to figure out the latch. And there was questions over whether he had a tongue tie, and I had it. I took lots of photos and I sent them to Shaheda, and I also took him to my hospital and asked them to check as well, because often it's better to check these things in person. And they were saying he hadn't, but he was showing some signs that he was. What happened quite early on sort of day 5, day 6, was that he developed jaundice. That was probably the biggest issue that we faced. And that all happened as my milk was coming in. I was trying to still figure out the latch. And when I went into hospital, it wasn't the hospital that I work in, so it was an unfamiliar environment for me. But unfortunately, I found that the help I received there was a lot from the health professionals that were there. Things were very busy. It was a night shift, and I think perhaps they thought because I was a midwife, I would be fine. But something that stood out for me at that time, which was really difficult, was they kept on making comments about how hungry my baby was, and they kept on saying, "Hungry, he's starving. He's hungry, he's starving." But I was feeding him and feeding him and feeding him as much as I could. But still trying to get to grips with it all. And there was a period of time where they sort of made me eventually agree to give my baby formula milk, which I didn't have a problem with at all. But yeah, it was a difficult time. I was there for about 24 hours, and he got better. And actually, I didn't go on formula feeding at that stage. I managed to get back onto breastfeeding. But I found those early days very difficult with getting his latch sorted and getting the hang of it, basically.
And how did you manage to sort his latch? What did you do?
Just a lot of patience, a lot of assistance, and getting Shaheda was my savior, but she would check all the time. I'd send her countless videos and pictures of him and showing her the attachment and how he was latching, and I figured it out that way. And it's a learning experience, not for me, but obviously babies are learning how to do these things. It's one of the most natural things in the world, but he had to learn himself too. So it took time for him. But once things were comfortable and his jaundice was settling and he was putting on weight and he was having wet and dirty nappies, that was enough for me to think, okay, we're starting to crack it now. We're getting there.
Lovely. Because you're absolutely right. I think the comments that you get from different people around you really make or break your breastfeeding journey, because the most common comment you will get is that the baby is hungry, the babies, you don't have enough milk. And I guess people around you don't really realize how discouraging that can be for a woman who's trying so hard, so ever so hard, who's been through the journey of childbirth, which is very exhausting and traumatic, and then now is trying to, sort of put up with and catching up on sleep and waking up every hour, and then being told that your baby's hungry, just, I think, is the last nail in the coffin sometimes. I mean, what sort of advice do you have for women out there who, are being told the exact same thing? You're not producing enough milk, the baby's hungry. What should they do?
Well, I think it's a bigger picture than that. Is the baby hungry? If we think, because I was convinced my baby was not hungry. He wasn't losing any weight at that time. He is having wet and dirty nappies, and I think his jaundice would have been there, despite how his feeding was. So if my feeding wasn't adequate enough, I think he probably would have been even more jaundiced. But he was at a level where he did need some treatment, and I just kept feeding and feeding and feeding him. You can only do what you can do, and I think having comments like that can be very discouraging, like you say. But I think there's a lot of I'm sure probably Shaheda covered this as well, but education about educating each other about what the normal breastfeeding journey can be. I mean, everyone's breastfeeding journeys are different, right? But you can have similar themes throughout. And I think as long as people know that most of the time, for most people, there are some problems and some issues that you'll have to overcome at some stage, whether that be tongue tie, whether that be latch issues, whether that be milk supply. But I think education about how long these things can take and what support is out there is really important. So supporting people and getting them access that they need to get that support is the most important thing, rather than making comments about the baby being hungry or baby losing weight. I think that's important, because otherwise those comments can compound people's feelings of inadequacy. If someone had a really traumatic birth, like you say, if they're then having difficulties feeding their baby, that can just compound those really negative emotions that they're feeling. They may be feeling guilty, they may be feeling inadequate. So it's really important to support one another when it comes to feeding the baby, I find.
Definitely. I mean, one of the most important things, I guess, is that the support is out there, especially when you need it, and, refraining from comments that are not helpful, perhaps, rephrasing what you're saying and not putting too much pressure on the woman, because as I've said before, I mean, I think I'm very fresh and new as well, because I had a baby only 13 months ago. So I clearly remember the whole process. And it was so exhausting. And you certainly don't need the discouragement of being told that you're not feeding enough, the milk is not enough, your baby's not feeding enough, the baby's hungry, doesn't look well. You need encouragement, lots and lots of encouragement. And it's very important that we sort of talk about this. And this is why I thought this is a very important topic for our show today. It's time for a break. If you want to be part of our show, our number is on your screen. Stay with us. Welcome back to Let's Talk. Before we went on to our break, we were talking about breastfeeding, and it was very important to talk about that because it's a topic that we don't really discuss, especially within the South Asian community. I think there's a lot of stigma still around it. You keep trying to breastfeed, and if you fail, then you just turn to the bottle. There's absolutely nothing wrong in that. But as we know, the benefits of breastfeeding are by far more than bottle feeding the baby in terms of brain development, in terms of immunity. It is absolutely the best form of milk that is available to our babies. On our show, we had lovely Tessa, who is a midwife as well. She's a specialist mental health midwife, but we were speaking to her about her journey because she did struggle a bit with breastfeeding initially, but she didn't give up. She persevered. She decided that she is not going to give up. She will not turn to the bottle. She will certainly keep trying. So, Tessa, before we went on to the break, you were telling us about how lucky you are in terms of support around you and how important it is for women to keep trying and not give up. And even if there are people around them discouraging them, telling them that, they're not good enough, they need to keep trying. But in real life, how practical is it to keep trying, especially for a mother who may be suffering from baby blues, who may be suffering from a bit of postnatal depression by now?
So I think issues with breastfeeding can definitely exacerbate those negative symptoms if someone is experiencing some postpartum anxiety or depression. I guess in answer to your question, it's really important to maintain a threshold. Although breastfeeding is hard and there usually is a lot of perseverance that needs to happen and a lot of patience with it too, it shouldn't really be to the detriment of your mental health. Obviously, if your mental health is deteriorating as a result of breastfeeding, then that's a massive problem. And actually, your mental health, your mental well-being supersedes that. Definitely. A happy mum equates to a happy baby. So it's important that the basic human needs are covered. And when you're in those early weeks, I'm sure you remember, Anita, when you had your children, those early weeks can be brutal. You don't know day from night and night from day. The baby's awake all the time and you're exhausted. So it's very common to feel tired, low, and tearful perhaps. Baby blues are very, very common too. About 80% of women develop baby blues, and they're not to be feared. They can come and they can be very brief, and then they go usually by 10 days, 2 weeks after you've had a baby. So that's a very normal thing to experience. But in terms of your basic human needs being addressed when you're trying to feed your child, someone there being able to feed you and giving you the time to be able to have a shower, have a nap. So having a support network around you is massive. Although you are the responsible person feeding the baby because it's your breast milk that the baby is having, if everything else around you is taken care of, that's a massive, massive help. But one thing I make really clear to the mothers that I see is that, this journey should not be at the detriment to your mental health. And I feel a bit of a hypocrite for saying that, because as I said before the ad break, I had a plan that I wasn't going to get too stressed about breastfeeding, and if it wasn't going to work for me, I would very easily turn to formula feeding, because I don't have an issue with formula feeding. But when it actually came to having my baby, I then suddenly had this deep maternal, guttural desire to breastfeed my baby, and nothing would stand in my way. I think a lot of mothers feel like that. But as long as you're being looked after, and it's not just you, your responsibility is to look after the baby, but you need to be looked after as well. So that needs to happen in order for you to look after your baby adequately. Well, not adequately, to look after your baby well. They say that it takes a village to bring up a child, doesn't it? But actually, I think it takes a village to look after a mother to bring up a child. That's what I believe.
Definitely. And Tessa, there is a lot of talk. I mean, you see many mums who perhaps came off their medications, came off their antidepressants because they were pregnant, because they thought the antidepressants might affect their baby adversely. And then after the baby's birth, they actually don't breastfeed the baby because they want to recommence their medications, and they're worried about the effects that the antidepressants can have on their baby if they're breastfeeding. What sort of advice do you have for people out there?
Well, first of all, actually, many medications that are prescribed for your mental health are safe to take in pregnancy and for breastfeeding. From the data and the evidence that we have around that, the majority of the medications that are out there are deemed safe. However, that doesn't mean that you shouldn't run that by your responsible clinicians. That could be your GP or your midwife, or if you're under a mental health team, for definite, they need to know that you're pregnant, and they need to know your plans for feeding your baby as well. Because it may be a case of your dose needs to be adjusted, or if you are on one of the few medications that are deemed unsafe, then that may be something that needs to change. Or it may be part of the plan if you're on many different types of medication, some of which are deemed not safe, then perhaps formula feeding would be a safer option, not just because of the medication, but also the side effects for you for having the medication. Some medication for mental health can make you very sleepy. So actually looking after a baby, if you're feeling that way, if it has that sort of effect on you, it would be perhaps better not to be breastfeeding your baby for that reason, rather than the actual medication itself. It's more the effects of the medication and what they have on you. So there's different plans for different people. But what I would say is also it's really important not to just stop your medication abruptly. If you're planning on stopping your medication because you're pregnant or because you're breastfeeding, do take advice from your responsible clinician first, because actually stopping them abruptly can cause more problems, and actually coming off them gently in a phased way is much safer for the mother. So it's good to be done in planned together with your GP or your mental health doctor or whoever it is that's responsible for your medication. But yeah, the majority of the medications that are used in this current day are actually quite safe to take.
And Tessa, in terms of support out there, I mean, you turn to Shaheda, but she offers a private service, which is well worth the money you spend because it's excellent service. But, in terms of the support that you get, if you can't afford the private service, what would you say is actually available for women out there?
So there's many different national breastfeeding advice. In Britain there is the National Breastfeeding Helpline, which is a helpline that people can use. I think it actually is 24/7. I'll have to check with Shaheda. She's actually the most knowledgeable person.
It is 24/7.
And then there's something called the La Leche League as well. They're also very good. There's NCT. But on a more local basis, the best person to speak to would be your midwife or your health visitor, because they will know the local support in your area. In many areas, they hold things called breastfeeding cafes, or they may have their own helpline that they use. And also, your midwife and your health visitor is also trained to help with the breastfeeding too. So if you're having issues with that, they can come out to visit you to help with that. As I'm saying this, I'm thinking back to my time when I had my baby, and it was in the full throes of the pandemic, and actually a lot of those things weren't available. So that was a huge problem. That was a huge problem for me, and it was a huge problem for many new mothers out there who were needing help. So I was very lucky that I had Shaheda on hand to help me. But many people wouldn't have been as fortunate as me to have access to that. So a lot of these things went to online, but I do think a lot of mothers suffered from not having that hands-on support, because obviously a lot of this stuff can be told to you over the phone or via a Zoom call. But with something like breastfeeding, I mean, for me personally, I'm quite a visual person, and to have someone physically there showing me or helping me has a much bigger impact, positive impact, than reading something or listening to something. So yeah, I'm sure the pandemic, I know the pandemic hasn't helped for lots of things, but that's one of the things for sure that would have suffered. But
Definitely have suffered.
Things are starting to normalize, and services are becoming are starting to recommence as well. So that should be coming back to normal. I would hope that the support levels have improved around that.
Yes, yes. Fingers crossed for that, Tessa. Fingers crossed for
Yes.
that. In the end, very quickly, is there any message that you have for women out there who are in a position where they are struggling to breastfeed?
So what I would say, I've got two things to say actually. One is do what's best for you and for your family. Don't feel under pressure to compare yourself to another mother or another family who may be doing something different. I had a plan and it didn't go to plan. So it's important to just consider all of your options and to just pick what's best for you and what works for you, because at the end of the day it's your family and it's your life and your baby's health, so you just need to choose for yourself what works best. And then my other thing is to both ask for and accept help where possible. And this is not just for breastfeeding. You know, if you're suffering or not coping well in those early weeks and adjusting to life as a new mum, people do want to help you and people do offer to help. So do take up the help when it's offered. And even if it's not offered, ask for it, because those practical things, as I said before the break, it takes such a huge weight off, you know, even just
it
for someone to
definitely does. Yes, definitely does, Tessa. It's golden advice that you've given us. Thank you so much for being on our show. We are limited with time. Viewers, I hope you had a lovely time watching us. We'll catch you again next week. Till then, Allah Hafiz.